On July 11, 2013, Carolinas College of Health Sciences hosted an interdisciplinary patient care simulation exercise involving nursing and radiologic technology students. This valuable educational enrichment opportunity was made possible through a grant from the Children's Miracle Network and provided knowledge of the clinical testing, teamwork, and procedures utilized in the diagnosis of pediatric appendicitis. Following a brief project overview by a CMC emergency department physician, Dr. Mark Bullard, 2 student simulation teams were assembled and briefed on the actions required in the simulation scenario. In each simulation situation, a pediatric patient presented suffering from lower abdominal pains with a possible diagnosis of appendicitis. Both simulation sessions involved a team of 2 nursing students assigned to the care and clinical workup of the pediatric patient actress and a radiologic technology student waiting to perform a portable imaging exam if requested by the supervising emergency department physician. The patient care team, nursing, and radiography students followed the directions initiated by the supervising physician, attended to the needs and pleas from the patient, and addressed questions from the patient and her mother, who was portrayed by another actress. In the first scenario, the mother of the patient was rather detached from the events taking place, and it was up to the student healthcare team to keep the mother involved, address to the young patient's concerns, follow the physician's orders, and work together to assess, address, and meet the clinical needs of the pediatric patient with the goal of enabling the emergency department physician to reach a diagnosis and proceed to the indicated intervention or treatment. The second simulation session essentially followed the same script as the first simulation with a new student healthcare team, but in the second session, the patient's mother was extremely engaged, very vocal, and repeatedly questioned the team's actions, doctor's orders, and was very concerned about the radiation dose from the portable X-ray image, as well as the CT exam that was ordered by the doctor. This more dynamic scenario challenged the student team members and required application of their patient care knowledge, critical thinking skills, patient and family engagement skills, and their abilities to maintain their composure while fulfilling the clinical needs required. Both of the simulated sessions were simulcast in a nearby classroom to the remainder of the nursing and radiologic students so they could observe and learn from their peers who were actively engaged in the student simulation teams. Upon completion of the simulation sessions and return of the student simulation teams to the classroom, Dr. Bullard provided a debriefing of lessons learned by the group. The interdisciplinary discussion facilitated by Dr. Bullard proved to be as lively as it was educationally enriching. The students were able to provide a knowledge-based critique of the scenario team members' actions and discuss the challenges faced and solutions for dealing with these scenarios in real-life patient care situations. Additionally, discussions ensued regarding the radiation dose from the various exams, new paradigms of imaging, and profession-wide actions, mandates currently used to reduce pediatric imaging dosage. The teamwork involved in the sharing of actions and knowledge across academic disciplinary lines and the need for additional enrichment opportunities between disciplines was noted by all. The knowledge gained by this project, the exchange of actions, support, and ideas between disciplines made it quite evident that the CCHS students are not only amenable to this practice, but eager to embrace this model of patient team involvement.